Welcome to this episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada, and today is the second Tuesday of the month. And as all of you wait for this special day, because my co-host is Dr. Arun Garg from Canada India Network Society, and he alongside gets some prominent person who talks about better health and integrative health. So today it's a great pleasure to have with us Dr. Arun Garg and Dr. Ramneek Dosanjh. And as usual, we'll go over to Dr. Garg and he'll be the one who'll be introducing our guest of today. Dr. Garg and Dr. Ramneek, good evening.
Good evening and nice to be with you.
Thank you.
It's a great pleasure to introduce my colleague, Dr. Ramneek Dosanjh. As you know, we have chosen our guest according to the work we are doing with them, and Ramneek represent that collaborative work we are doing together between Canada India Network Society and Dr. Dosanjh. Dr. Dosanjh is a family physician, very passionate about community health, very passionate about justice system, but most importantly, currently she is also president of Doctors of BC, a great honor and a great privilege, and she's representing doctors so well this year, Harpreet Singh ji. So we are grateful to have her, and let's go.
Absolutely. That's a wonderful introduction, Dr. Garg. Thank you. And once again, Dr. Ramneek, welcome. So as Doctors of
Thank you.
BC, President from January 1, 2022 for one full year, what's the mandate that you're focusing on, Dr. Ramneek?
So my mandate has three parts, and first and foremost, we are committed to better patient care and outcomes for what we advocate for, but also physician health to make sure that our physicians are healthy in this healthcare system that is in some need of some repair. So taking it back to the healers and helping them heal. And the third approach that I'm incorporating is justice, equity, diversity, and inclusion. And that is what I've been sought out to do during this year, which doesn't think it's a tall order, but I am definitely in company of a wonderful board, colleagues and mentors that inspire me and support me, and along with the community to try to change for the better.
No, that's excellent. These are three wonderful mandates, and all three need to be looked into because what we find out is, especially after the pandemic, the burnout and the kind of struggle and the kind of achievements that have been achieved by the medical fraternity is really commendable. So we salute you and your colleagues for doing whatever you have been doing. Coming to this important aspect of integrative health, from how do you view this?
I believe that integrative health is essential to having the best patient care and the best outcomes. I believe that an integrative system, a healthcare system which talks to one another and has the holistic perspective to improve the outcomes of our patients, but also our society at large.
And you are going to be one of the speakers at the City Conference, which is happening in the month of June. And of course, you'll be highlighting a lot of issues over there also. So, Dr. Garg, when you met Dr. Ramneek and you have brought her as one of the panelists, what was in her that you found that she would be the right person who can advocate this important issue?
Well, first of all, she is a very dedicated, day in, day out family practitioner. And as you know, though our focus is general population, we bring the lens of South Asian population. And Dr. Dosanjh, and if I could address her as Ramneek, I've known her for many, many years in many capacities, represent that. I have had many discussions with her where she has indicated to me that after this year is over, she's going to work with Canada India Network Society in building this integrative care approach. And integrative care, as you know, Harpreet ji, is really is a approach, is a thinking. So what we're really promoting is how you think about health. How do you bring people together? And Ramneek represent that. So it was not too difficult for me to ask her to be on the panel.
Right. Now, Dr. Ramneek, you have pointed three particular points. One is better patient care. The second one is, the physician's health. When you talk about better patient care in British Columbia, as president, this is a major issue. People talk about these things that when they go to for medical services, Even at emergency rooms, they have to wait for long. Well, of course, this needs to be addressed by the politicians, but has to be brought forward from the medical fraternity. You also must be finding this a major critical challenge. So, on this particular aspect, as you said, you're also meeting with the top bigwigs of the government. So, how do you feel that this issue needs to be addressed?
So, better patient care and healthier outcomes, we know, is with an investment in primary care health system. We know the best world healthcare systems operate with a robust network where we have primary care integrated to be able to deliver the type of care our patients deserve. So, better patient care can only be done with a really robust investment in the critical infrastructure and support for physicians on the ground, as well as our team-based allied healthcare professionals, our nurses, our staff, in order to be able to provide the care to our patients. And it should be wrapping around integrative services around the patient and their needs. In order to be responsive to this, we do need more collaboration with our government partners and other agencies to ensure that our patients can actually get that kind of care that they deserve.
And how do you feel, Dr. Ramneek, that societies like Canada India Network Society play an important role? Because Dr. Garg has been passionate in spreading this information in the community. He has been doing a lot, going to temples, going to gurdwaras, through these programs, through the media. He has been highlighting that we need to take control of our health. So, of course, what we are finding out right now is that still, especially in the South Asian community, there are many issues which need to be addressed. So how do you feel that such kind of societies play an important role?
I think the societies are really helpful because when not only is he bringing great awareness to the topic, but to bring innovation and solutions to our bigger problem. We need our patients and we need the citizens involved in the care delivery, but also how they're going to receive the care. I think a lot of information and education that's provided to our patients only helps in their healthcare outcomes. And we need everyone involved. It's a true collaboration. And when we do learn all of the learnings from that Cine has set up, especially the network within India, and seeing the changes, I was privy to one of the events a few years ago, and I saw the change in infant mortality and morbidity rates. It's just amazing on how much they've accomplished in 20 years there. And then we need to look at those learnings and share them here. We've got great opportunity for growth and solutions right now. So I think if we are open to receiving what has worked in other jurisdictions and involving our patients and the grassroots initiative to be able to fold into this level of integrative health, I do believe this is the way forward.
Right. And Dr. Garg, how is it beneficial to have doctors like Dr. Ramneek on board and who also propagate about integrative health?
Well, I think right from day one, as you know, Canada India Network Society is a virtual collaborative approach. So we need help and support of all the leaders. And I've been very fortunate to get Doctors of BC as a big supporter. Every year we have had their support at the meeting and an ongoing basis. So I think, and especially with Dr. Dosanjh being from the community, I'm really looking forward that post president here, she will be actively working with us in the community. And also she is a family physician. And I do want to reaffirm the role of family practice in this integrative approach, because you were asking how to improve the system. One of the areas is in this, what we call community chronic care. And that area, family practice is the backbone. Right. And I think through some innovation, collaboration, and good conversation, we need to find a solution where family practitioners are actively participating and involved and building a better system. Now, we have, obviously, it's easy to say than achieve, and we are not quite there, but I think it's the effort like ours and working with, I'm really hopeful that post Doctors of BC here, Ramneek and I will work together, especially in our community, because I think our community is ready for it. And if we could build a capacity in the community to engage the community and have also family practitioners feel part of it. So it's not like at the exclusion of them, but they are part of it. I think we'll have a winner. So this is a very positive potential.
Excellent. Sir, and Dr. Ramneek, it's time for a short break. We'll go for a break and we'll be shortly back and we'll continue with the discussion and learn more from you about the second major issue that you want to focus on during your tenure as the president of Doctors of BC, which is physicians' health. And along with that, you are also an author also, Dr. Ramneek. So we'd like to know about the book that you have written, and also you have been advocating for child mental health wellness programs. So we'll learn all this after this short break.
हर रंग है साडे को, हर मॉडल, हर एक दी अपनी वक्री पहचान। असीं एक परिवार हाँ, साडा कर्म है अगे वधाउणा, सफर नूं सौखा बनाउणा। बसंत मोटर्स, तुहाडे नाल, तुहाडे करके।
है जुल्म ढाने का अंदाज भी कितना हंसी, हमारी जान पर बनाई है जब जब उसने अंगड़ाई ली। कभी खामोश रहते हैं, कभी शोर होता है। मोहब्बत में शरारत का मजा कुछ और होता है। दिल को जज्बात का तोहफा, खामोशियों को बात का तोहफा, खूबसूरती में जड़ी नजाकत अदाओं की चांद से मुखड़े को चांद सा तोहफा।
भारत ज्वेलर्स, सच्चे प्यार की चमक जैसा। फाइल बिजनेस सेंटर सरी।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ, ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
स्वागत करते हैं जी एक बार फिर आप सब ਦਾ ਅੱਜ ਦੇ ਇਸ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ। ਮੇਰਾ ਸਾਥ ਰਹੇ ਨੇ ਡਾਕਟਰ ਰਮਨੀਕ ਦੋਸਾਂਝ, ਜਿਹੜੇ ਕਿ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਨੇ ਡਾਕਟਰਸ ਆਫ BC ਦੇ ਇਸ ਸਾਲ ਦੇ 2022 ਦੇ ਵਿੱਚ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਰਹਿਣਗੇ, ਅਤੇ ਡਾਕਟਰ ਅਰਨ ਗਰਗ। ਅਤੇ ਅੱਜ ਹੈ ਮੰਗਲਵਾਰ ਦੀ ਸ਼ਾਮ, ਤੇ ਹਰ ਮੰਗਲਵਾਰ ਦੀ ਸੈਕਿੰਡ ਜੋ ਹੁੰਦੀ ਹੈ ਮੰਥ ਦੀ ਸ਼ਾਮ ਅਸੀਂ ਤੁਹਾਡੇ ਨਾਲ ਇਸ ਕੋਲੈਬੋਰੇਟਿਵ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਕੁਝ ਮਹੱਤਵਪੂਰਨ ਵਿਸ਼ਿਆਂ ਤੇ ਗੱਲਬਾਤ ਕਰਦੇ ਹਾਂ। ਸੋ ਡਾਕਟਰ ਰਮਨੀਕ ਜਿੱਥੇ ਡਾਕਟਰ ਫਿਜ਼ੀਸ਼ੀਅਨ ਹੈਗੇ ਨੇ, ਪਰ ਉਸ ਦੇ ਨਾਲ ਨਾਲ ਇਹ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਜੋ ਹਨ, ਇਹਨਾਂ ਨੇ 3 ਮੈਂਡੇਟ ਜਿਹੜੇ ਨੇ ਕਿਹਾ ਹੈ ਕਿ ਮੈਂ ਇਸ ਟੈਨਿਓਰ ਦੇ ਵਿੱਚ ਅਕੰਪਲਿਸ਼ ਕਰਨਾ ਚਾਹੁੰਦੀ ਹਾਂ, ਅਤੇ ਬਹੁਤ ਵਧੀਆ ਬੋਰਡ ਇਹਨਾਂ ਦਾ। ਅਤੇ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਬੈਟਰ ਪੇਸ਼ੈਂਟ ਕੇਅਰ, ਫਿਜ਼ੀਸ਼ੀਅਨਸ ਵੈਲਨੈਸ ਅਤੇ ਥਰਡ ਜਸਟਿਸ, ਇਕੁਇਟੀ, ਡਾਇਵਰਸਿਟੀ ਦੇ ਉੱਤੇ ਫੋਕਸ ਕਰਨਗੇ। ਇਹਨਾਂ ਇਸ਼ੂਜ਼ ਉੱਤੇ ਅਸੀਂ ਅੱਜ ਗੱਲਬਾਤ ਕਰਨੀ, ਅਤੇ ਨਾਲ ਇੰਟੈਗਰੇਟਿਵ ਮੈਡੀਸਨ, ਇੰਟੈਗਰੇਟਿਵ ਅਪਰੋਚ ਦੀ ਕੀ ਇੰਪੋਰਟੈਂਸ ਹੈ ਉਸ ਉੱਤੇ ਫੋਕਸ ਕਰ ਰਹੇ ਹਾਂ। ਸੋ ਲੈਟਸ ਗੈਟ ਬੈਕ ਓਵਰ ਟੂ ਬੋਥ ਆਰ ਗੈਸਟਸ ਐਂਡ ਕੰਟੀਨਿਊ ਵਿਦ ਆਰ ਡਿਸਕਸ਼ਨ. So Dr. Ramneek, like you mentioned before the break about the first mandate that you are focusing on, the second is physicians' wellness. On this particular aspect, what do you feel as president? What do you want to achieve?
Well, we know that post-pandemically, our physicians are really suffering. It's got the highest level of burnout and moral distress that we've ever seen in our profession. And even before the pandemic, it was challenging because of all the stress, the increased volume of work, the increase of patients that don't have access to a family doctor, and the increasing complexities of care and management in a system that needs a very dire change.
So as far as the burnout is concerned, Dr. Garg, would you like to recommend? What kind of practices which they need to, the doctors also, the medical fraternity also needs to incorporate, sitting, breathing, what all would you like to recommend?
Yeah, this, as you know, is a topic of great interest to me personally. And talk of burnout, having done 50 years and 40 years as consulting, I think I'm a very good example of how to avoid burnout and what burnout is. And I think I congratulate Dr. Dosanjh for taking this on. Very important topic. I think I would like to emphasize is we need to encourage our physicians to be much more part of system. One of the reasons which leads to burnout is when you feel you're not part of the system and things are being done to you externally and you have no control. So whatever we do, we need to bring a process whereby family practitioners especially feel they're part of the system. They have influence on the system. I think we don't fully appreciate people look at the doctors and say, oh, you're a doctor, you have total control. How little control we have on the system. So as a policymaker, as a president, and I've been there before 20, 30 years ago, so I know the feeling. I think we need to also work on that. In addition to that, the role of mind and intellect. And this is where yoga science plays a very important role of empowering the individual. So I think slowly but surely, I'm very happy to see that physicians are talking about it. The funds are being made available, the services are being made available, so they can talk about their anxieties, their requirements. And I think Dr. Dosanjh is playing a leading role through Doctors of BC. It's a very positive step.
And Dr. Garg, here we also need to mention about one important aspect which doctors many times neglect because the kind of lifestyle they lead, eating habits. And over there, I think something needs to come forward from your side and with Dr. Ramneek at the helm of affairs that needs to be incorporated, that in the hospitals also, instead of the vending machines, we're just sorry to use this word, garbage is given, something good, nutritious is also offered.
Yeah, I think it's a very good point. As I remember in my days, there used to be cigarette vending machines. Could you believe? In
Okay.
hospitals, there used to be vending machines not that long ago.
Right.
And there was a doctor, Dr. Tom Godwin. He used to go around and putting paper clips in the vending machine to stop the cycling. And before you know, obviously, vending machine disappears, cigarette disappears. So healthy eating and the healthy food distribution, I think we all working towards it, and I think more and more that's happening. But you're right. And if you look at the vending machines now, they are distributing
Much
much
better now.
healthier food. Yeah, yeah. But I think you're right. That's another thing we see. And I think the way cigarette machines have gone, and I think we have to make sure that the vending machines also have healthy food.
Absolutely, and here advocacy plays a very important role, and government needs to be approached on this aspect also. So, Dr. Ramneek, on this particular issue of the kind of lifestyle that you lead, the mental stress, and apart from that, the physical toll, that you work so much, so many hours, and it's a constant run. So many times doctors don't find time for themselves. So on this particular aspect, when you talk about physicians' wellness, are you looking into this ground also?
Absolutely. You raised such a good point. And I feel that if we are in the profession of looking after other people, we need to be looking after ourselves. And unfortunately, what you speak to, even from the vending machine comment, we have to be very conscious of what's around us. Our current healthcare system, including our hospitals and our clinics, have not been set up to promote health. We have been treating symptoms, and unfortunately, we've been in a kind of a reactive mode. We've been dealing with the emergencies and the urgencies we do in medicine and have not had time to lay down the framework that it needs to actually provide health and deliver health and well-being to patients. And us as physicians, we are sometimes the worst culprits because we are in this profession because we care about our patients. And sometimes we care so much about our patients that our empathy takes over our own needs for ourselves. I know this, of course, firsthand. I've had physical ailments that I've also been quite sick and ill in the hospital, only to learn part of my recovery was that making sure that I put myself first or my needs of my self-care that went beyond my patients. And that's something really hard to grapple with because we are educated in a system and we are trained in a system which does not necessarily promote health. We are working between 80 to 100-hour weeks. We are constantly told that the most important thing is your patient, even beyond your own physical needs. So when we're trained in a system that way, when we continue to go in the workforce and the workforce conditions don't permit the ability for us to have healthy breaks and to try to take time off. Most physicians I know work during the pandemic 6 to 7 days a week and many hours, and sometimes pulling 2 shifts. And the coverage has been so difficult for physicians to be able to get access to having some time off, even for their own personal well-being or their own illness or to spend time with family. We know that the most important things in what we do for ourselves and our self-care routines and to promote healthy lifestyle is to be able to have social connection and to be able to be surrounded in a system that also works for us. Doctors are so passionate about advocating for their patients, but it's really difficult to navigate in a system that is completely broken. So that's why the need for integrative health is so important. we need to take better care of ourselves, but we need systems that help promote the care of our own selves, especially what you've said, even in the hospital. Our environment needs to be reflective of health and well-being and not just sickness and illness.
The clock is ticking towards a short break, but before I go for a short break, one small question: that you're also an author and you've written a book called Dreaming. What is this all about?
So Dreamland was an initiative between myself and my oldest daughter, Naya. And initially it was during my own training where I realized, some nights you don't get to tuck your child in. And a lot of physicians feel this. Sometimes we're away from our children, or even working parents and working families, that they may not be able to be with their child when they're tucking them in. So this important lesson for me was about connection. So even if we're apart from our loved ones, that gives an opportunity for them to connect with us in a dream space. And sharing in that dream space with your child allows you the ability to know about where they're at. And so it gives you a little bit of insight into their mental health and well-being as well.
Great, wonderful. Dr. Garg and Dr. Ramneek, a short break. We'll be shortly back, and in the last segment, we'll continue our discussion on justice, fairness, equity, and also we'll talk a little bit about Dr. Ramneek, you being a passionate advocate of children's mental health. What is this major issue? Because right now the statistics that are coming are quite alarming, and we need to start looking into those. So we'll talk all about these issues after the short break.
ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਅਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀ ਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀ ਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ, ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀ ਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਵੈਨਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼, ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 13042 84 ਐਵਨਿਊ ਸਰੀ। ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363। Once again, welcome back to the program. ਅੱਜ ਸਾਡੇ ਨਾਲ ਡਾਕਟਰ ਰਮਨੀਕ ਦੋਸਾਂਝ ਅਤੇ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਸਾਂਝ ਪਾ ਰਹੇ ਨੇ। ਤੇ ਦੂਸਰਾ ਇੰਪੋਰਟੈਂਟ ਐਸਪੈਕਟ ਜਿਸ ਦੇ ਉੱਤੇ ਡਾਕਟਰਸ ਆਫ BC ਦੇ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਵਜੋਂ ਇਹ ਕੰਮ ਕਰਨਾ ਚਾਹੁੰਦੇ ਨੇ, ਉਹ ਹੈ ਫਿਜ਼ੀਸ਼ੀਅਨਸ ਦੀ ਵੈਲਨੈਸ। ਖਾਸ ਤੌਰ ਉੱਤੇ ਫਿਜ਼ੀਸ਼ੀਅਨਸ, ਜਿਸ ਤਰ੍ਹਾਂ ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਹਮੇਸ਼ਾ ਹੀ ਆਪਣੇ ਪੇਸ਼ੈਂਟਸ ਦੇ ਬਾਰੇ ਜ਼ਿਆਦਾ ਸੋਚਦੇ ਨੇ ਤੇ ਕਈ ਵਾਰ ਆਪਣੀ ਇਹਨਾਂ ਦੀ ਹੈਲਥ ਨਿਗਲੈਕਟ ਹੋ ਜਾਂਦੀ ਹੈ, ਜਿਸ ਕਾਰਨ ਕਾਫੀ ਸਮੱਸਿਆਵਾਂ ਆਉਂਦੀਆਂ ਨੇ। ਉसी ਦੇ ਉੱਤੇ ਡਾਕਟਰ ਗਰਗ ਦਾ ਕਹਿਣਾ ਹੈਗਾ ਕਿ ਇੰਟੈਗਰੇਟਿਵ ਅਪਰੋਚ ਜੋ ਹੈ ਬਹੁਤ ਮਦਦਗਾਰ ਸਾਬਤ ਹੋ ਸਕਦੀ ਹੈ ਕਿ ਫਿਜ਼ੀਸ਼ੀਅਨਸ ਜੇਕਰ ਆਪਣੇ ਉੱਤੇ ਵੀ ਸਮਾਂ ਲਾਉਣ ਤੇ ਉਸ ਨਾਲ ਉਹ ਬਿਹਤਰ ਆਪਣੀ ਸਿਹਤ ਮੇਨਟੇਨ ਰੱਖ ਸਕਦੇ ਹੈਗੇ ਨੇ। ਇਸੇ ਸੰਬੰਧ ਵਿੱਚ ਗੱਲਬਾਤ ਨੂੰ ਅੱਗੇ ਤੋਰਦੇ ਹਾਂ, ਲੇਕਿਨ ਉਸ ਤੋਂ ਪਹਿਲਾਂ ਦੱਸ ਦਈਏ ਕਿ ਅੱਜ ਦਾ ਇਹ ਪ੍ਰੋਗਰਾਮ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚਾਇਆ ਜਾ ਰਿਹਾ ਹੈ AMC ਇੰਸ਼ੋਰੈਂਸ ਦੇ ਸਹਿਯੋਗ ਨਾਲ। ਹੋਮ, ਆਟੋ, ਟਰੈਵਲ, ਬਿਜ਼ਨਸ, ਲਾਈਫ ਜਾਂ ਰਿਕ੍ਰੀਏਸ਼ਨਲ ਇੰਸ਼ੋਰੈਂਸ ਲੈਣ ਦੀ ਸੋਚ ਰਹੇ ਹੋ ਤੇ ਇਹਨਾਂ ਦੀਆਂ 9 ਬ੍ਰਾਂਚਿਸ ਨੇ ਲੋਅਰ ਮੇਨਲੈਂਡ ਵਿੱਚ, ਜੋ ਕਿ ਹਫ਼ਤੇ ਦੇ 7 ਦਿਨ ਸਵੇਰੇ 9 ਤੋਂ ਲੈ ਕੇ ਰਾਤ ਦੇ 9 ਵਜੇ ਤੱਕ ਖੁੱਲ੍ਹੇ ਰਹਿੰਦੇ ਨੇ। ਹੋਰ ਜਾਣਕਾਰੀ ਲਈ ਕਾਲ ਕਰ ਸਕਦੇ ਹੋ 604 507 6666 604 507 6666। ਸਾਡੇ ਅਗਲੇ ਸਹਿਯੋਗੀ ਹਨ ਅਗਨੀਹੋਤਰੀ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟਿੰਗ। ਟੈਂਪਰੇਰੀ ਸਟੇਟਸ, PR, ਨਵੇਂ ਹੋ ਕੈਨੇਡਾ ਵਿੱਚ, ਅੰਤਰਰਾਸ਼ਟਰੀ ਵਿਦਿਆਰਥੀ ਹੋ, ਸਿਟੀਜ਼ਨਸ਼ਿਪ ਬਾਰੇ ਜਾਣਕਾਰੀ ਲੈਣੀ ਹੈ, ਹਾਇਰ ਕਰਨੇ ਫੋਰਨ ਵਰਕਰਸ, ਐਕਸਪ੍ਰੈਸ ਐਂਟਰੀ ਜਾਂ ਫਿਰ ਸਪਾਂਸਰ ਕਰਨੇ ਪੇਰੈਂਟਸ ਜਾਂ ਗ੍ਰੈਂਡ ਪੇਰੈਂਟਸ। ਤੁਹਾਡੀ ਮਦਦ ਕਰ ਸਕਦੇ ਨੇ ਨੀਰਾ ਅਗਨੀਹੋਤਰੀ, ਜੋ ਕਿ 2006 ਤੋਂ ਸਰਟੀਫਾਈਡ ਇਮੀਗ੍ਰੇਸ਼ਨ ਕੰਸਲਟੈਂਟ ਵਜੋਂ ਕੰਮ ਕਰ ਰਹੇ ਨੇ। For honest and reliable information, you can call her at 604 597 2284 604 597 2284। ਸੋ ਪ੍ਰੋਗਰਾਮ ਵਿੱਚ ਮੁੜ ਤੋਂ ਤੁਹਾਨੂੰ ਸ਼ਾਮਿਲ ਕਰਦੇ ਹਾਂ ਤੇ ਦੋਨੋਂ ਹੀ ਮਹਿਮਾਨਾਂ ਨਾਲ ਗੱਲਬਾਤ ਦਾ ਸਿਲਸਿਲਾ ਅੱਗੇ ਤੋਰਦੇ ਹਾਂ। So Dr. Garg and Dr. Ramneek, once again welcome back, and the third major aspect on which you're going to focus as president is about justice, equity, diversity. So could you elaborate on this particular aspect? What do you want to do on this ground?
Sure. I will start with the equity and diversity piece. And we know that in medicine, our gender inequities have been quite alarming, and they've been raised nationally with the gender pay gap, and to realize that our female colleagues get paid substantially less than our male colleagues. And we are looking at patterns of practice and what influences cause this. And at Doctors of BC, we're really engaged in developing our policy position, which we hope that will take to external stakeholders to make a gold standard that we can actually confront some of the issues that are actually happening in our province, in our profession, and look to other professions and what they're doing about it. The other piece is diversity. We know that diversity of thought and inclusion of people from different aspects of whether they've got diverse backgrounds or diverse experience is actually essential into providing the care, because our patient population is diverse, and we need to address the anti-racism that needs to happen in medicine and healthcare delivery. We know that Mary Ellen Tufard's report of In Plain Sight for our Indigenous patient populations was a starting point for our conversations, but we also know within our own communities there's been a bias in the delivery of care has been impacted. So we are trying to look at issues and how we can raise them and change the way that we do things. So really asking for a significant culture change. And when I'm speaking about the justice sector, I actually found my own personal experience within the family law and system in the recent years has been quite illuminating in the fact that I've learned that it's not only the healthcare system that's broken, but there's aspects of our justice system that is broken. And it's important that we have the ability to advocate for our patients and the well-being of our community, that we should actually embark on intersectoral allyship. So the first time in history that Doctors of BC is embarking on an intersectoral allyship with our partners at the BC Law Society and Access to Justice BC. Just this last week, we did a launch on May 7th on National Child Youth Mental Health Day, also my oldest daughter's birthday, to embark on a new frontier, to create a dialogue, a table where all doctors and lawyers will come together and we'll share our learnings, our experience, and hopefully advocate for our families and the children to ensure that we have a more seamless approach and something that we can prevent their adverse childhood experiences, which we know are very detrimental to, and I see very often for both our patients in our community, but patients from all walks of life.
That's again a very important point that you have touched. You're a child and youth mental health advocate. And as you have pointed out, that this is a major challenge right now which needs to be addressed, and probably it is not getting that much attention which it should. So as you have also pointed about the social determinants of health, could you elaborate on this as to where do we stand today? Why is it that this particular aspect needs to be given much consideration and we need to start working on this?
Absolutely. We know that the social determinants of health adversely affect outcomes in health. We know that our patients are only as well as addressing the social justice causes, whether that's poverty reduction, whether that's housing, whether that's access to care and barriers to care, and looking at abuse within the household or within the environment that a patient is exposed to. A patient can come to your clinic or to the hospital and receive care, but the barriers that we are looking for them to be able to improve their health, we need to look at the holistic aspect of health, and that includes social determinants of health. We need to make sure that we are influencing as much as we can on the ground and in the community as we are in our office settings or in the hospital patient-doctor relationship.
Over to you, Dr. Garg.
Yeah, thank you. Well, quite a conversation there, because I think Ramneek is very passionate about it. I think it will be reasonable to remind our viewers that this conference coming up in June, so June 17, 18, 19, they can still register on our website, Canada India Network Society, and the theme is Women's Health. And a lot of areas Dr. Dosanjh has covered will be covered on Saturday morning, and it's complimentary. All they need to do is just register on our website, www.thecins.org. And on Sunday, we have a very special program on integrative care. And just to emphasize further what Dr. Dosanjh was saying, that in medicine we pay a lot of attention to the acute care, what I call institutional acute care. One area which is ripe for innovation, and that is community chronic care. So that is the space when between office visits, even how you are relating, how you are connecting, how you think of health. And that's what we'll be talking about. And doctors like Dr. Dosanjh, Dr. Brendan Byron, Dr. Balpava will be talking about their experience, how they have incorporated some of those ideas in their practice. So I think it'll be a very interesting session that way. If I could just pick up on one thing Dr. Dosanjh alluded to, and that is the diversity and inclusiveness. And physicians have been very diverse from day one. And I think doctors of BC, one of the first ones to have diverse individuals aspire to be leaders. So I think we have provided that leadership, and that I think for our viewers it's important that there is hope. And I think it's when we talk about inclusivity, to me, inclusivity means that everyone who has an ambition to be what they want to be become that without any barriers. And I think we all need to work towards Canada India Network Society. As you know, its vision is building healthy civil society. And civil word includes education, health, and justice. So I think I was so happy to see Dr. Dosanjh bringing health and justice together at a formal level. So that's wonderful, because that's how we'll create civil society.
Very true, absolutely, and that's a collaborative approach which comes forward is always good for the community at large. Dr. Ramneek, you talked about the mental health issues. Mental health challenges are on the rise, whether it is the youth or we see in the general population. So the mind-body connection, and of course with the holistic approach that you mentioned. So with your experience as a physician, if you would like to give us some tips today on this particular issue as to how we need to face this major challenge, whether it is the youth or the elderly.
So I think the first thing is recognition and awareness, and knowing that in this post-pandemic world, even navigating the pandemic was anxiety provoking for adults, and imagine changing the world for the children. So children are usually pretty adaptable to change, but the problem was that there was a lot of fear provoking and uncertainty. And when there's uncertainty in an environment or any element of it, we need to look to our role models and the modeling that happens around us. And unfortunately, with the loss of social connection and routine for children during the pandemic, as well as stressed adults and seeing even our healthcare system stressed, was difficult for them to witness. And now that we are aware of this, we need to look to one another to use the tools. Kelty Mental Health through BC Children's Hospital has a great website for resources for children and families. I think seeking help and counseling, as well as seeking access to your family doctor to be able to speak about these issues and concerns, is really important. Another way that we need to make sure that our patients, which are our children and recipients of care, is to integrate with the education sector. And that is my next hope, is that we can try to partner with the education sector and realize how important health education, as well as delivery of tools. My hope is that every child in this province would have an ability to have the tools needed to navigate their own anxiety and to really think about breathing and the mind-body connection. We know if we learn these skills at a young age, it only helps these kids flourish into adulthood. We need to build systems that encourage the growth of the brain development for children and to mitigate adverse childhood experiences, such as these anxiety-provoking events or different factors within the home. So what viewers can do is really seek out resources. There's many websites that have been developed. I keenly like Kelty because they are the gold standard for a lot of the care that we provide, but also seeking the advice of your family doctor, which I know not everyone has access to family doctor right now, and our hope is to work with our government to change that and have the availability. And we need to reiterate how important education and awareness, as well as making sure that someone knows if a child is not doing well and is struggling, that they're alerting a caring adult, but also liaising with the family doctor to access community resources and also the helps of further professionals if needed. So I think a lot of the work is in the parenting, but we need to equip our parents with the right education and the tools to be able to provide that. I think the most important thing I want people to know is connection is so important. Dialogue and connection and promoting a healthy environment to have that discussion with your children, as well as their teachers and their counselors, and keeping it in a very aware perspective that we know that we can change the way their thinking is. And a lot of it's to do with bringing them back to their own body and reminding them the space that they're in and the control they have over their breath. So just simple strategies. Happy to come back on your show and have a segment of that. But there's a lot of my
Absolutely.
colleagues. Yeah.
Excellent. Thank you so much. In conclusion, Dr. Garg.
Yeah, thank you very much. And I think, again, thank you, Ramneek, for joining us. And we are really looking forward for June meeting, and we'll be exploring it further. So again, for our viewers, RPG, the registration is open, Canada-India Network 2022, June 17, 18, 19. And on our website, Canada-India Network Society, and it's complimentary Saturday and Sunday. I would say the key message for today through Dr. Dosanjh and family practices, first, that the family practice doctor is the backbone of bringing together in the community. So now we need, our challenge is how to build this capacity in the community so family practice doctor is able to use these services. And I think that is a very big challenge in this chronic community care. So I would think that integrative care is another option whereby this kind of work can be established and those facility and capacity in the community. So I'm really hopeful that the work of the doctors of BC and Dr. Dosanjh and our own work eventually will lead, at least in a limited way, to lower the burden of chronic diseases. So quite exciting.
Very true. Thank you very much to both of you for sparing your valuable time and being a part of this program. Dr. Ramneek and Dr. Garg, thank you very much. And of course, as Dr. Ramneek, you said, in future, we'll focus on different issues and we'll talk in details. Thank you very much for your time.
Thank you. And remember to register for our conference, right?
That's right.
Yeah,
at
just
the cns.org.
Yeah.
Yeah. Thank you. ਸੋ ਇਹ ਸਨ ਸਾਡੇ ਅੱਜ ਦੇ ਮਹਿਮਾਨ ਡਾਕਟਰ ਰਮਨੀਕ ਦੋਸਾਂਝ, ਜਿਹੜੇ ਕਿ ਇੱਕ ਫੈਮਿਲੀ ਫਿਜ਼ੀਸ਼ੀਅਨ ਨੇ, ਤੇ ਨਾਲ ਡਾਕਟਰ ਅਰੁਣ ਗਰਗ ਸਿਨੀ ਤੇ ਦ ਹਰਪ੍ਰੀਤ ਸਿੰਘ ਸ਼ੋਅ ਵੱਲੋਂ ਹਰ ਸੈਕਿੰਡ ਟਿਊਜ਼ਡੇ ਨੂੰ ਅਸੀਂ ਇਹ ਪ੍ਰੋਗਰਾਮਸ ਦੇ ਵਿੱਚ ਤੁਹਾਡੇ ਨਾਲ ਸਾਂਝ ਪਾਇਆ ਕਰਦੇ ਹਾਂ, ਜਿਸ ਦਾ ਮਕਸਦ ਹੁੰਦਾ ਹੈ ਕਿ ਜਿੱਥੇ ਅਸੀਂ ਫੈਮਿਲੀ ਪ੍ਰੈਕਟਿਸ, ਜਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਸਾਹਿਬ ਨੇ ਕਿਹਾ ਕਿ ਇੱਕ ਬੈਕਬੋਨ ਹੈਗੀ, ਇੱਕ ਫੈਮਿਲੀ ਫਿਜ਼ੀਸ਼ੀਅਨ ਤੁਹਾਡਾ ਬੈਕਬੋਨ ਹੈਗਾ। ਕੋਈ ਵੀ ਮਸਲਾ ਹੋਏ ਤੁਸੀਂ ਪਹਿਲਾਂ ਉਸ ਦੇ ਕੋਲ ਜਾਓ ਤੇ ਉਸ ਨਾਲ ਡਿਸਕਸ ਕਰੋ। ਨਾਲ ਹੀ ਡਾਕਟਰ ਰਮਨੀਕ ਨੇ ਜਿਹੜੇ 3 ਮੇਜਰ ਪੁਆਇੰਟਸ ਐਜ਼ ਪ੍ਰੈਜ਼ੀਡੈਂਟ ਕਿਹਾ ਕਿ ਉਹ ਅੱਗੇ ਲੈ ਕੇ ਆਉਣਗੇ, ਉਸ ਉੱਤੇ ਆਸ ਕਰਦੇ ਹਾਂ ਕਿ ਸਰਕਾਰ ਵੀ ਪੂਰਾ ਸਹਿਯੋਗ ਦੇ, ਜਿਹਦੇ 'ਚ ਜਿੱਥੇ ਲੋਕ ਆਪਣਾ ਯੋਗਦਾਨ ਪਾ ਸਕਦੇ ਨੇ ਉਹ ਜ਼ਰੂਰ ਆਪਣੀ ਆਵਾਜ਼ ਬੁਲੰਦ ਕਰਨ, ਤਾਂ ਕਿ ਅਸੀਂ ਇੱਕ ਬੈਟਰ ਹੈਲਥ ਸਿਸਟਮ ਜਿਹੜਾ ਹੈਗਾ ਹੋਰ ਬਿਹਤਰ ਬਣਾ ਸਕੀਏ। ਤੁਹਾਡਾ ਮੇਰਾ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ ਮੰਡੇ ਟੂ ਫਰਾਈਡੇ ਸ਼ਾਮ ਦੇ 6 ਵਜੇ ਦੇ ਪੈਸੀਫਿਕ ਟਾਈਮ ਦੇ ਮੁਤਾਬਿਕ, ਅਤੇ ਇਸ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਵੀ ਸ਼ਾਮਲ ਹੋਣਾ ਚਾਹੋ ਤਾਂ ਮੇਰੇ ਨਾਲ ਸੰਪਰਕ ਕਰ ਸਕਦੇ ਹੋ 604-603-7555, or you can email me at theharpreetsingh@gmail.com। ਇੱਥੇ ਹੀ ਕਰਦੇ ਹਾਂ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸਮਾਪਤੀ, ਤੇ ਜਾਂਦੇ ਜਾਂਦੇ ਮੁੜ ਤੋਂ ਦੱਸ ਦਈਏ thecins.org ਤੇ ਜਾ ਕੇ ਤੁਸੀਂ ਜੂਨ ਦੇ ਵਿੱਚ ਜਿਹੜੀ ਸਿਨੀ ਕਾਨਫਰੰਸ ਹੋ ਰਹੀ ਹੈ, ਸਿਨੀ 2022, ਉਸ ਦੇ ਵਿੱਚ ਮੁਫਤ ਰਜਿਸਟਰ ਹੋ ਸਕਦੇ ਹੋ, ਤੇ ਉਸ ਦੇ ਵਿੱਚ ਬਹੁਤ ਸਾਰੀ ਇਨਫੋਰਮੇਸ਼ਨ ਤੁਹਾਨੂੰ ਨਾਮਵਰ ਡਾਕਟਰਸ ਅਤੇ ਸਪੈਸ਼ਲਿਸਟ ਵੱਲੋਂ ਦਿੱਤੀ ਜਾਏਗੀ। ਸੋ ਪਲੀਜ਼ ਜਾ ਕੇ ਰਜਿਸਟਰ ਆਪਣੇ ਆਪ ਨੂੰ ਕਰਵਾ ਲਓ। ਇੱਥੇ ਹੀ ਕਰਦੇ ਹਾਂ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸਮਾਪਤੀ, ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। Have a safe evening, stay healthy and enjoy yourself.